Hello and welcome to Business Spotlight. I am privileged to have Sydney here. And Sydney, I am looking forward to hearing what you do and how long you've been doing what you've been doing.
Yeah, so Sydney and my name's Rowan. We both opened a practice, a midwife practice that's called Thrive Midwifery Services. So we do all prenatal care, home birth setting, and postpartum breastfeeding support for women that are looking for a more naturalistic option. And so we kind of take the place of an OB for people that are hoping for more of out of hospital, like homey type care.
Oh, I love that. How long you all been doing this?
We just opened this year.
Awesome.
But we've been midwives in a variety of different settings. We've worked in birth centers, small home birth practices. So we've been in the birth world attending births for over 5 years now.
How fun. That's got to be such a rewarding time. So who is a best customer for you or best client for you?
For us, that would be, well, of course, somebody who is pregnant or hoping to be pregnant in probably the next year or so, but also somebody who is wanting to really take control of their care and their health. We always say that, we are their healthcare advisors, right? And so we don't make any decisions for our patients, but we lay out the options for them so that they can make the decisions for themselves.
Mm-hmm. So in general, like women and families that are just looking for more family-led care and have enough time to really ask their questions and want to focus on patient education.
I love that. That is so great. So where did your, what kind of changes did you see in the last couple of years?
For our business, well, actually, in general,
Mm-hmm.
there has been this switch, especially after COVID. I think a lot of families were starting to ask themselves, there has to be a better way to do this, to birth or for birth, for prenatal care. And so there has been this mind shift over the past couple of years of where we're going back to more traditional care for families, which is really great for us. And I think it's important that news kind of gets spread around to all the other families that there is a better way to be cared for.
And in a lot of other countries, midwifery care and out of hospital care is considered the norm. And that is why most of those countries are very far above us when it comes to maternal mortality rates, neonatal mortality rates. And so I think America as a whole, these last couple of years, has really been trying to focus on addressing why we have numbers that are as poor as they are right now.
I love that. I love that. So COVID kind of helped folks get back into this, hey, being in the home and getting more natural is what I'm hearing you say.
Yes, absolutely.
Right. Awesome. Awesome. So let me ask you this. What has been the biggest learning in business so far, owning a business, being a business owner?
I would say learning about having a business, for us, what was the most eye-opening was how crucial and helpful it is to have people surrounding you in the community that, like you yourself, who are like, hey, we want to bring up this business. There's such a wonderful birth community here, from doulas to lactation consultants to other midwives to chiropractors, that all of them have been very welcoming to us, have really helped us take really big business steps in this area.
Great. Great. I love that. So what would be a good partner, somebody that you could partner with?
That would be people who are other healthcare providers that have more of a natural mindset. Our practice, we marry the two styles of let's try to do natural things, holistic care first, but also the importance of medicine and science. We are evidence-based practitioners. So that's something that's important for us to find in other providers as well. That we provide attentive care, and we expect that from other providers. And so chiropractors, I would say, acupuncturists, things that we can refer our people out for. Midwives can do a lot of things, but we can't do it all. So we love to be able to find good providers that we can refer out if need be.
I love that. I love that. So would a holistic physician be kind of in your arena?
Sure, absolutely. And then other things that might come up during pregnancy, especially like chiropractic care, that really tends to make births go easier and quicker. Also, you know, when you're growing a whole baby, it can be a little uncomfortable. So,
Yeah.
so that's usually somebody we'll refer out to.
Or the pelvic floor therapists for after the births.
Okay, I love that. Do you have anything upcoming that we should know about? Any kind of event or things that you're celebrating?
So right now, our main thing is that we're kind of getting into the community here, and so that means that, you know, we're networking with a lot of other practitioners and other like mom groups, things like that. So we don't have anything that would be an event coming up soon, but we are hoping to sort of be a center for a community at some point, where moms and babies can come for education, support, and families can kind of come together and meet each other through our practice and what we can do with that.
Yeah, and our hopes too, probably our first event will be potentially an office opening, which would probably happen at the beginning to middle of next year.
Oh, how exciting. How
Yes.
exciting. You know what I love about that is community, just bringing community together and having that support system. That's what it sounds like you guys are really wanting to do.
Absolutely. It's needed. I think that there's a deficit in maternal health care that we're trying to really close that gap. It's about community and empowerment for us,
And access.
and access as well.
Cool. All right, so let me ask you this question. What kind of motivates you both and what keeps you motivated?
So when it comes to motivation, you know, most midwives will tell you that they felt called ever since that they were young, and both of us have very similar upbringings in that we recognize like we were just saying, the deficit in maternal care and support and birth, and we've kind of taken a step away from generational knowledge when it comes to birth, and we want to welcome that back. And so seeing great grandmothers at their great grandkids' births and seeing families come together and being like, wow, I did it, and I'm making decisions for myself and my family instead of just, you know, trusting a doctor and not really knowing what's going on. And so seeing women bloom into this new knowledge and recognition that they have full control is what motivates me. And I think both of us.
That's perfect. Absolutely.
I love that. I'll tell you, I've really enjoyed being with you all today. You know, this is a great opportunity to get the news out. Sydney, Rowan, thank you so much for being here in Business Spotlight. I am Tona with Action Coach Tampa Bay. Have a super day, and we'll see you next time.
Awesome.
Thank
Thank you.
you.